Hello everyone, in this lecture we will talk about Meconium Aspiration Syndrome. It is a breathing problem which occurs when the baby inhales the meconium. When it enters into the lung, it causes respiratory problem or respiratory depression. It may seen during before or during birth when birth is ongoing. If you don't know about meconium is a thick, sticky tar-like substance that is the baby's first stool. When the first stool that passed by baby, that is called as meconium. It is made up of cells, mucus, hair, bile, and other materials. Typically, baby pass meconium within 48 hours of birth, but in some cases, it may pass during labor and delivery. Therefore, the risk of aspiration is high, and this syndrome is mostly seen in the post-term pregnancy or in the condition of prolonged labor. Let's talk about pathophysiology. In 10 to 20% of all birth, meconium passed into amniotic fluid. So the meconium get mixed with the amniotic fluid, and that fluid is called as what? Meconium-stained amniotic fluid. Only 2 to 10% of baby born through meconium-stained amniotic fluid develop meconium aspiration syndrome. If neonate aspire the meconium, it enters into the lung and it will cause respiratory distress. But if the baby does not aspire, instead of that, he may swallow the meconium, then it will enter into the gut and it does not cause that much problem in compared to the aspiration. So the aspiration the risk of meconium aspiration syndrome is high, and if the baby get inhale the meconium, the problem may arise. But if baby swallow the meconium, this problem is not seen. Therefore, it is called as meconium aspiration syndrome. It is more common in full term birth, means after 40 weeks, or post term birth after 42 weeks. So when the meconium enters into the lungs from terminal bronchioles, enter into the alveoli and small and large airway, it will block, resulting in the atelectasis. Atelectasis is the partial or complete collapse of lungs or its lobe. And emphysema may also seen. Generally, emphysema is a chronic lung disease, but in there permanent destruction of alveolar wall is seen and abnormal dilatation of alveoli is seen. Therefore, emphysema may also seen in this condition. And these two conditions, atelectasis and emphysema, may lead to pneumothorax. Pneumothorax is also called as air leak syndrome. Due to atelectasis and emphysema, the ventilation and perfusion mismatch occur, and which will eventually lead to respiratory failure. Clinical feature: since it is a disorder of respiratory depression, therefore breathing problem will seen, that is difficulty in breathing, dyspnea, heart rate will also decrease, and cyanosis is seen because low oxygen saturation of blood, and tachypnea is seen, increase in the breathing rate, and grunting is seen. Grunting is basically it is the low pitched abnormal breathing, that is called as grunting. Chest retraction is seen. In chest retraction, during inspiration, you will see the lungs moving inward. Generally, inspiration lung move outward, but in chest retraction, during inspiration lungs move inwards. And limpness is also seen. Limpness basically it is the loss of muscle tone or strength. So the limb or body appear soft, or you can say floppy and weak. So that is limpness. Sign of Meconium Aspiration Syndrome. Amniotic fluid appears greenish brown, and if the baby get exposed to that meconium-stained amniotic fluid, baby's outer appearance like skin and nail get yellow, and when you see umbilical uh, cord, its color is also change. Note: if baby swallow the meconium, it is okay. It is not matter of concern, because if a small amount of meconium baby swallow, it's not cause for worry. But if baby inhale meconium, it directly enters the lung and it will be dangerous, because it blocks respiration and leads to respiratory depression, and if does not resuscitated in the time, then it will eventually leads to respiratory failure and also death. Diagnosis: watch the sign of aspiration after birth, and also watch the sign of distress. Doctor may also do chest auscultation to hear the abnormal breath sound, and chest x-ray is also done. Management: treatment depend upon the volume and consistency of meconium. Generally, if the meconium is thin, then it's less dangerous, but if meconium is thick, then risk and mortality of meconium aspiration syndrome is high. If baby born and crying and active, it means baby is well and treatment is not required in that case. First line treatment for meconium aspiration syndrome is meconium suction, in which a bulb syringe is used to remove the meconium from mouth, nose and throat. Tube is inserted through the throat to remove the additional meconium from the airway. If baby facing still breathing problem, then the face mask is placed with oxygen supply. Baby with meconium aspiration syndrome needs to stay in the NICU. The doctor does not discharge immediately after the resuscitation. They keep the baby for monitoring and also for advanced treatment, and that may include use of ventilator or surfactant or antibiotic to open the lungs and clear any infection. And ECMO may also done intracorporeal membrane oxygenation, and radiant warmer is also used to control the baby temperature. And during respiratory depression, baby unable to breathe, so positive pressure ventilation is done, that is CPAP, continuous positive airway pressure. Complication of meconium aspiration syndrome may include pneumonia, asthma, pulmonary hypertension of the newborn (PPHN), pneumothorax and hypoxia. So that is all about meconium aspiration syndrome. If you like, I hope you found this video useful, so don't forget to like, share and subscribe. Thank you for watching.